in your book, Heart and Soul of Change, I may have misread it. I think it
Mm.
was an attribution of 15% on the model. And you're kind of comparing it to 1% now. Has there been new research or new developments since
Yeah.
that?
So in 1999, in the first edition of the Heart and Soul, we talked about 15%, and that particular figure was based on Michael Lambert's assessment and guesstimate of the figures. In the intervening years, a fair bit of very sophisticated research has been done, and it turns out that the figure is closer to 1%.
Okay, this is really interesting. All right, um, I'm gonna throw one at you. Does that
Mm.
mean that all the research we do to investigate different models and the efficacy of models and putting out what works for different conditions, is that a misguided venture, in your
Well,
opinion?
it's all embedded in a paradigm or a framework for understanding the data. If you think of psychotherapy like a medical treatment, or let's say open your mouth, let me shine the light, you've got little spots in there, you must have strep throat, I'm going to give you this antibiotic. The assumption is that in the antibiotic there's something specific, an ingredient which is specifically remedial to the disorder, strep throat, being treated. It kills the bacteria, you're cured. If you think psychotherapy works like that, then our last 40 years of research have been exactly on point. If you look at the outcomes of that research, which basically find that all of these approaches work about equally well, that any differences are most likely due to differences in methodology and very little to the particular problem being treated or the ingredients being delivered, well, then maybe what that calls for is a different view of how we work. So one of the factors that have leverage on outcome, reconnecting this back to where we were before, is that your care has to have a structure, a rationale, and an engaging ritual, and associated techniques that help you operationalize that rationale for the client. So what is and so what's effective about CBT is not that you actually confronted dysfunctional thoughts, but rather that the client finds your explanation compelling and is willing to take action in the room or outside of the room with you. Once they get activated, it doesn't really have anything to do with their confronting their dysfunctional thoughts, but that they took a few steps, they feel emboldened, empowered, and they can move on. The point is that it contributes overall very little to the outcome. And if you were coming in to see me as a coach and I didn't have access to your data, I wouldn't assume that that was most likely your problem, because there are factors that have much higher leverage on outcome. Let me give you them in order. Next, in terms of contribution, is the creation of hope and expectancy. So it contributes about 4% to the outcome of psychotherapy, 4% of the variance associated with treatment outcomes, hope and expectation. Contributing about twice as much as that, about 8 to 9%, are relationship factors, empathy, goal consensus, congruence, etc. So we're starting to get in an area where if I knew nothing about you and I didn't have any access to your data, and I'm just playing the base rates, I would probably assume that any improvement that could take place in your performance would probably be had by focusing on your relationship abilities. They likely break down at certain predictable points in your work, maybe with certain kinds of problems, maybe with certain kinds of people, maybe with certain kinds of emotional presentations or interactions in the room. And the one of the other factors that contributes a slight bit more are what are called therapist factors. Again, about 8 to 10%. The therapist's ability to respond in the moment, their level of reflective functioning, etc. These are all factors which have leverage on it. So think of the point we're making here. You engage in your performance and we assess. We find that with X kind of client presenting X problem, you're not as effective as you are overall. We then look at that and try to map it onto these factors. Does this have to do with your structuring of the session, model and technique? Does it have to do with the failure to create hope and expectation? Does it have to do with poor engagement of that client, or your reaction or lack of reaction to that client? Here are all the factors. Once we map it onto those factors, we can develop exercises that help you work that factor to your benefit and your client's benefit.